So thank you all for being here today. We're going to pivot now to the second part of our symposium, which is really a panel discussion. And in this discussion, we're going to be exploring the question of how active citizenship can actually improve health outcomes for members of a democratic community. We're joined today by a really terrific panel who you'll meet in just a second. We have an international human rights expert, an emergency room doctor, and a voter registration advocate. We have the mayor of a major US city with us, and a nursing school dean, who will all talk about how the practice of citizenship is linked to health outcomes, and what steps we can all take to hold governments accountable and join with others to make meaningful change and improve health in our own communities. The discussion is going to be moderated by my friend and my colleague, Seth Levine. Adam is the SNF Agora Institute Associate Professor of Health Policy and Management at the Bloomberg School of Public Health at Johns Hopkins University. So before I invite Adam up here to introduce the panel, I want to share a few real-world examples of civic engagement and activism that have resulted in healthier communities.
Wigan Borough is one of the biggest councils and boroughs in the country of England. It's an ex-mining district, ex-industrial area, but now made of many, many green spaces. We have 325,000 residents, so a big place with hearts of gold of the people who live here. Back in 2010, the government policy was decreased public sector spending. Our budget reduction was in the region of 40%. We knew that we needed to do something really transformational, really radically different. So the Wigan Deal is a concept around thinking about the public sector differently. It's much more a sort of a togetherness, so collectively what we can do together. We've really actively listened to our communities, our citizens, and they know the solutions to the problems in the communities, and what they needed us to do is come alongside them. The deal has really helped to improve citizens' health in lots of ways. We're really investing in the arts and culture programmes, promotion of our parks, promotion of our green spaces, getting people more involved in recycling programmes. Also a big focus around reducing cardiovascular disease. We've done CPR training. We've also now trained 10,000 people as dementia-friendly advocates, trained 4,000 autism friends across the borough. We've got communities in charge of alcohol programmes, and that's people taking charge of their own health. These are active community members who are not politicians. They're just people who are invested in their local areas. I think when you're doing public service transformation and sort of a radical approach, one of the barriers is really thinking about this is going to be a long journey. But I think if we can harness that hope and that creativity and that love and really, activate ourselves together, we can have active change for good.
Lead-containing paints, which are used to decorate homes, schools, and products, can cause lifelong health problems. The globally recommended limit on lead in paints is 90 parts per million. In our studies, many samples were found to contain above 10,000 parts. So we reached out to the government, industry, and consumer sectors to build a strong case for lead paint elimination. We organized sustained public information activities, which really helped in catalyzing awareness and support. But we were a bit unsure how we would be received by the paint companies. In the end, we found a common purpose in protecting current and future generations from the adverse effects of lead exposure. That became our basis of unity. Finally, in December 2013, the Department of Environment and Natural Resources issued a chemical control order setting the strictest legal limit for lead in paint worldwide. Our experience shows that a strong health-based policy is necessary, but it does not end there. We need to continue raising awareness and monitoring compliance to the regulation. There are many threats to democracy, particularly to people's participation in public affairs. So we really need to defend that space for communities to get involved. There is power in people linking up for a common purpose. We need to find our oneness and unity in working towards a better society.
Hi, everybody. I am Seth Levine, and I am thrilled to be here today with all of you on behalf of this great panel. I recognize that we are sort of rushing headlong into hour number 2, and so I want you to know that we have extra fabulous people here with us who are going to share a bunch of insights that are both interesting and actionable. And I think what we saw in the video just now were some really great examples of sort of like links between active citizenship and health. And what we're going to hear from our great panelists are some other really fantastic examples of that. So what I'm going to do, we've prepared a couple of questions, and we're going to do a little bit of a round-robin format of those questions. What I'm first going to do is just name each of the people on either side of me, and then in a second I'll give them a few more minutes to introduce themselves with a little bit more detail. And of course you have short bios that are in the program as well. David Holt, Giada Girelli, Sarah Santon, and Alistair Martin. And so let me just sort of jump right into the questions that we have. And so first of all, we're going to give each of them about 3 minutes for each of these questions. And so the very first question is if you could just please introduce yourselves and talk a little bit about your work, especially as it relates to active citizenship and health. And so we'll start with you, David.
I thought we were going in alphabetical order. Am I first?
Oh, I was told to go now in the order of...
All right. Fair enough. I'm David Holt. I'm the mayor of Oklahoma City. So Oklahoma City is right in the middle of the United States. It's the 20th largest city in the United States. It's also the state capital of the state of Oklahoma. You know, every city in the United States has a very different form of government. And so we're all a little different. And having said that, you know, in most cases, local government doesn't typically have strong ties to health. But that certainly changed dramatically in 2020 when every mayor, especially in states where maybe the governors were less interested in responding to the pandemic, which was, you know, about half the states, in those states, and certainly to some degree all states, mayors became like chief medical officers overnight and certainly had to become very fluent in issues of health. But I would also say that specifically in Oklahoma City and probably in other communities, we have other ongoing interactions with a healthy life that certainly go hand in hand with a healthy civic culture because we need to have, you know, a strong citizenry advocating for our prioritization of health. And I'm sure we'll get into that a little bit more in the other questions. But in Oklahoma City, we recently passed about 3 years ago an initiative that is promulgating, you know, the built infrastructure for a healthy lifestyle. It's building mental health crisis centers and senior wellness centers and other things that are certainly directly on point to the health of our residents. And of course, moving forward, although the pandemic is certainly in a different chapter now, you know, we hope to carry through the lessons that we learned from that experience and continue to focus on you know, a prioritization of health in our residents and certainly a prioritization of following science. And that's a little bit as a mayor how I interact with some of these issues.
Great, thank you.
Hi, everyone. Oh, yes. First of all, thanks to the SNF Agora Institute and to the organizers for having us here today and inviting us to this beautiful library here to discuss health and democracy today. I am a senior analyst at Harm Reduction International. Harm Reduction International is a non-governmental organization working to promote evidence-based, health-centered, and human rights-centered drug policies, with drugs being understood primarily as a health issue. And so we work to reduce the negative health, social, and legal impacts of drug use and drug policy through research and advocacy. The Human Rights and Justice team I work on focuses on issues at the intersection between drug control, health, and democracy, with a focus on participation and accountability. And we focus on the health and human rights impacts of drug control on marginalized and criminalized populations, so populations which typically have less of a voice in the political process. We monitor and report on violations of human rights committed globally in the name of drug control, and coordinate advocacy at the UN level and in other relevant international fora. During COVID-19, and just to say, drug control being misperceived as sort of a criminal justice issue, we can see directly the negative impact of mischaracterization of health issues into criminal justice issues, and then the impact that it has on democracy and rights. During COVID-19, we started paying, as everyone, a lot of attention to COVID, but also COVID-19 responses and their impact on those marginalized and criminalized communities. And we really focused on analyzing and highlighting the ineffectiveness of very securitized responses on the health rights and on the state of democracies worldwide. And this was done building on the lessons from other responses to also drug-related strategies, but also HIV/AIDS-related strategies. And at the same time, paid a lot of attention to the positive role that communities can play, and how civic participation and countering securitized responses with participatory and enabling responses could really have a positive impact on the COVID-19 response. As a last point, as I said before, we focus a lot on international fora, so all these in places which are more on a global international level where global health issues are discussed. These are places that are really foreign to us. We tend not to pay a lot of attention to them because they're far away, they're not the most transparent places to engage in, and so we tend to forget about them. That's a bit of a shame, because these kind of fora really have an impact on our health and the health of our communities, and so we're working very hard to ensure meaningful civil society and community participation in those fora now with the negotiations of this new pandemic treaty at the World Health Organization. So I'll stop here, baby, but I'm sure we can discuss more later.
Absolutely. Great. Thank you. Sarah.
Yeah, hi, good morning. It's wonderful to be with you all. I'm a dean at the Johns Hopkins School of Nursing, and until 10 months ago, I was a researcher and nurse practitioner. I provided a decade's worth of house calls to older adults who were homebound, and in that practice, often people needed to throw their keys out the second floor window for me to find in the grass because they couldn't get to their door, and some met me on their hands and knees to let me in. And I'll just start with a quick story that I think is relevant to today. We developed a research program that's now spread in many states across the country called Capable, which helps older adults be able to function better in their homes. And one person I'm thinking of was a veteran of a US war, and he lived in terrible pain. He had a completely flat affect, meaning no smile, no twinkle in his eyes. And he was on dialysis because his kidneys had stopped working. And the only time he left his home was to get in a van to be hooked up to a machine to change his blood out because his kidneys didn't work. And so when he joined the Capable program, he had these conditions where you just thought, we're not going to make any progress with this gentleman. But he came up with goals. Part of the program is you come up with your own goals about what you want to be able to do. And he wanted to be in less pain. He wanted to be able to shave standing up. He got around his house in a wheelchair. And currently, before we came, he was dribbling, water and shaving cream all in his lap, and shaving standing up was something probably none of us would think of that someone would make a goal, but that was really important to him. He also, one of his favorite things to do was to sit out his back step and listen to the birds, but he could only do that when his grown grandson could come over and lift him up over that stoop. So he wanted to be able to shave standing up and get outside himself to his back porch. And with working with the nurses and the occupational therapists and a handy worker, he improved his strength and balance, he improved his pain. We put a lot of grab bars around his sink and around his back door. We did other things also, but the point of the story is he was able to stand up to shave, and he could go in and out himself to listen to the birds. And after that, he started doing other things. He had a twinkle in his eye, a smile. He was going to community events. And we weren't coming in and saying, you should really do this, and you should do that, and you need to take exercises, and you need to go to community events. All we did was address what his goals were. And I tell the story because there's no throwaway people. In a democracy, everyone matters. And for those of you who are clinicians, if he had presented to your office, you probably would have thought, oh golly, this guy's in pain and there's nothing we can do, and he's just in a wheelchair at home most of the time. But here he is now engaged in community events, and we need to act like every person matters in a democracy, because they do.
Great, thank you. Thanks for sharing that story too. Alistair.
I love that story, and I think the other important part of that story is it highlights how nurses really are the heroes of our healthcare system in the United States, so thank you for that. I'm Alistair. I'm an ER physician. I'm also an assistant professor at Harvard Medical School, but now I work as an advisor to Vice President Kamala Harris here at the White House on voting rights. So I want to tell you a little bit more about the work that we do at VoteER, but before I do, I want to tell you a quick story. So it was maybe 2 a.m. on a Friday night, and I was in the ER, and I was at our children's hospital, at Boston Children's Hospital. And I had a young lady come in who was maybe 24 or 25 with her 2 children, both of whom were younger than the age of 3. And she said to me, "Doctor, you know, I had to just move in from another state about 5 months ago because I needed to escape an abusive situation with the father of our children." And she said, "You know, I live in Boston now with an aunt who was able to take us in, but over the course of the last couple of days, that aunt, who had her own mental health issues, she kicked us out. And last night, it was 2 degrees outside, and the kids and I slept in the van. And tonight, we were going to do the same thing. But I looked back and I saw my 2-year-old shivering in the back seat. And she said, there's no way I could do that to them again, so I brought them here. Can you help me?" And I'm in the ER, and I hear this story, and of course I say to her, "Of course we're going to help you." In my mind, I have no idea what we're going to do. So I called the social worker. I said, "Look, we've got this woman. Can we get her help?" The social worker says, "Yes, you know, we have a state-based program. We need to, you know, get her into a transitional housing unit. She just needs to provide some proof of residence." So I go back to the patient and I say, "You know, do you have a phone bill or a check stub or something that says that you live in Massachusetts?" And the patient says, "No, doctor, as I told you, I just moved here about 5 months ago." So I said, "Oh my God." So I call the social worker again. So she doesn't have proof of residence. What can we do? He says, "There's nothing we can do." I said, "Come on, there's got to be something." He says, "Well, there is one thing." I said, "What's that?" He says, "We can register her to vote. Her voter registration would count as proof of residence in the state of Massachusetts." We're going to talk about maybe later on why you have to register to vote in the United States to be able to vote, even if you're a citizen, a little bit later. But the point is, I walked back to the patient, and I asked her one of the most sort of life-changing questions for me as an ER doctor, and that was, "Do you want to register to vote?" And 2 things happened. The first is, she said to me, "No one has ever asked me that before. I didn't know I could." So we registered her to vote. But the second thing that happened was I started to think, how many of my patients were in the same exact scenario? I've seen 15 to 20,000 patients. How many of them have not been registered to vote? And so that was the impetus to start VoteER, which is a really cheesy name, I know, but I think it gets the point across. We use healthcare facilities and healthcare providers to register their patients to vote. I have one example of what that looks like here. We create these lanyards and these ID badges that allow patients to register to vote using their own phones. We have 25,000 physicians that use these, and nurses and social workers. And we've helped about 50,000 people across the country get registered to vote or get their mail-in ballots in the 2020 election. And one day, there will be a time in the United States where every hospital you walk into, there will be a voter registration apparatus if we're lucky. So thanks again for having me here.
Great, well, thank you. So far we've gotten a bit of an initial flavor for some of the amazing work that all of our panelists do. And so now we're going to sort of transition and ask a little bit more that kind of speaks to these deliberate links between active citizenship and health that people may not always see as being linked. And so I do want to just sort of note before I ask this question to the panel that when we talk about sort of citizenship, we are thinking about it as a broad conception of citizenship. And so we're not thinking about it in terms of one's formal legal rights, but rather as a pro-social contributor to a community. And so with that kind of a notion of citizenship in mind, what does active citizenship mean to you? How do you see it as linked to health and vice versa? So we'll start with David again.
Well, I mean, all the usual things. You know, I look at this, you know, obviously I'm sort of a practitioner in politics, and I look at citizenship in my community as all the things you would expect. It is exercising the muscle that was described earlier. It is voting. It is, you know, being a consumer of the news. It is being someone who's sophisticated enough to parse out, you know, fact from falsity. But I think that really what matters for this conversation, and so many that relate to democracy, at least in the United States, is we also, as policymakers, have got to create, you know, a forum where that desire to be an active citizen is rewarded appropriately. And so what I mean by that is, you know, in Oklahoma City, when we elect mayors, when we vote on initiatives like the one I referenced earlier that is building mental health crisis centers and senior wellness centers and all these things, we do that collectively as a community. And so everybody's vote counts as it should. They get to weigh into the major election, and they count just as you would expect when you sort of, the way it was envisioned, you know, here 2,000 years ago. But in America, in so many other elections, we sort of silo out people. We create closed partisan primaries, and it really sort of dilutes people's opportunity to be a contributor to the final outcome, and sort of divides up groups of people who may otherwise have the voting power to see their priorities realized. And in this case, it might be a prioritization of public health. And so we see that time and time again. I mean, if you were to poll across the United States or poll even individually in every single state, I think you would clearly have a majority of people, for example, who wanted to see the type of mitigation measures against COVID-19 that were employed in many places around the United States. I think that would have been a universal desire. But in certain states, we sort of had a tyranny of the minority because of closed partisan primary processes. And so the desire by our citizens to be good citizens was not rewarded. They were basically told no, that, you know, even though there's probably 60 or 70% of you that want to take COVID-19 seriously, all that matters is in a state like Oklahoma, the Republican primary voters and what they want to do. And they're really, we're talking about at this point, a plurality of a plurality. And so the prioritization of health is something that I think is fairly popular across the United States and in each state and in each city. But how you run the elections is not doing our part as policymakers to accomplish and reward good citizenship. So I think individuals know how to be a good citizen. Whether they do it or not is a totally different question. I think we all know the answer of how you do that. But I think that policymakers, those who create our processes for dictating outcomes, are doing a very poor job of allowing citizens to see, you know, their majority will exercised across the entire United States.
Great, thank you. Giada.
Great. So let's divide up the active from citizenship, and let's start from citizenship first, appreciating that we are really talking about citizenship in the broadest possible sense. And to me, citizenship is all about rights and related duties. It's about seeing oneself as inherently and inextricably linked to the community. It's about that concept of me being because you are, and of being all part of a oneness, that we like it or not. And then starting from that, citizenship then becomes all about opportunities for participation and equal and substantial opportunities for participation. So citizenship really being one with participation. At the same time, and so really contributing to the polis, to the city as the Greeks imagined it 2,000-3,000 years ago. Citizenship, however, doesn't exist in a vacuum. It's not enough to only talk about it. It cannot be only theoretical. And in order for citizenship to be active, then we really need a lot of enablers, a lot of elements that support it and make it possible. And I'm talking about different things. One of the main ones is transparency. We cannot be active on something that we don't know anything about, or that we don't have any evidence to think about in a critical way and react to. And working on drug policy, we're confronted every day with the failures of governments, in many cases, to really give us and guarantee us the transparency we all have a right to. I'm also talking about other enablers, such as liberty, of course, and also formal spaces where to act, that commitment to participate. Not everyone has access to those formal spaces. Sometimes they don't exist. When they don't exist, it's important that we organize and become active to carve those spaces for everyone. But I'm also talking about a very practical and basic set of enablers that I think we can all instinctively understand. And there are things such as food, housing, education, and health. Every one of us that's been sick knows how hard it is to focus about anything else when we don't feel well, when someone in our family doesn't feel well. And so we see how health becomes an essential precondition to participation. And we see this sort of dynamic and bidirectional relationship a lot when we talk about both health and participation. So health and essential healthcare is fundamental to be active citizens, is fundamental to be able to participate, but at the same time, participation is also a contributor to health. We see and we know from evidence that participation of the community actually makes health better. And so one of the reasons why we advocate for participation in local as well as international environments is not only because we believe it's the right thing to do, or we believe we have a right to do so, but it's because it's actually proven to make health better and more effective for everyone.
Great, thank you. Sarah.
I was going to make the bidirectional point as well, and happy to give other examples. As one example, people often join our Capable program to be able to do for others. So they wanted to be able to take in a foster child, for example. We had several who joined so that they could take 2 buses to get to the elementary school to tutor children. And for the 2020 election, we had many who made it their goal to be able to vote. And there is mail-in voting in the United States, but for people who are disenfranchised earlier in their lives, a lot of times people feel like they want to stand there in line as long as it takes to cast their vote themselves. Mm-hmm. And it was so moving to us that compared to all the other things that they might have wanted to choose to work on, it was they wanted to be able to participate in democracy. And I want to, Mayor Holt talked a little bit about what we've learned from the pandemic. Certainly part of that is that remote participation should be able to be allowed. And, people with disabilities, lifelong disabilities, or older adults with disabilities were able to testify remotely or able to meet with congressional staff remotely. We should keep that. It shouldn't just be we go back to only the people who can get around easily can participate so much. And I think that Minister Tang was very eloquent about all the different ways of being able to participate. I also just wanted to call out that for the Native Americans and indigenous people in many countries, may have a harder time participating in democracy. For example, in the United States, on Navajo reservations, some people have to drive 70 miles to get to their mailbox. So not just 70 miles to get to a polling place. And many Native American reservations don't have physical mailing addresses that are recognized by the post office. So maybe you can work on that. But the ability for everyone to participate is not even.
Thank you, Sarah. I'll let the Vice President know. I want to first do some level setting, and that is to call out one of the quirks of the American democratic system. I would actually frame it a flaw, but I don't want to be subjective here. And that is that in the United States, even if you're a citizen, you can't just go to the polling location and vote. There's another active process that you have to decide to do and then complete, and that is called voter registration. All right, so let's start there. Okay, now I have a question, and this is a question for the audience, and I want just the Greek citizens to shout out answers, okay? So we have 329 million people in the United States. How many people do you think are not registered to vote in the United States? Just call out a number. Is it 1 million? Is it, what do you guys think?
Anybody?
Voting age eligible. Thank you for the for that flag. Voting age eligible. How many people do you think are not registered to vote in the country? Okay, we got 10 million. What else?
Got all the way up top.
1 in 15. Okay. All right. So that would be like 15, 20 million. Y'all, it is 53 million people are not registered to vote in the country. Greece has 10 million people. That's 5 times the population of Greece that is not registered to vote in the United States. Okay? So one day I was taking care of a patient who came in with asthma. This is in 2021. We were just leading up to the mayoral election in Boston. And this young woman, she's a Latina woman, she's maybe early 20s. She saw me with my lanyard on. You guys saw the lanyard that has registered a voter. It says a vote on the lanyard. So she looked at my lanyard. She said, "Doctor, why does that lanyard say vote on it?" And I said, "Well, it says vote on it because I want you to take 30 seconds while you're here and just make sure, just check if you're registered to vote or not, because we had a big important election coming up." And she said, "No, I'm good. I'm good. I don't do that." And I said, "What do you mean?" She said, "Well, look, I don't think it's worth it, you know?" And I said, "Okay." I had some time. You know how it is. You don't always have time like this. I had some time. So I sat down and I said, "Look, you know how you're here for your asthma, right? You have asthma just like the majority of people in the neighborhood you come from in South Boston, because that's where the chemical plants are. That's where the tire manufacturing facility is. That's where our refinery is that pollutes the air. Those plants are not in the Back Bay. They're not next to Boston Gardens, the really nice parts of town. They're in your part of town because they know folks aren't going to say anything. And so it's important for you to make your voice heard. I'm going to help you with your asthma here, but the only way we're going to get those pollutants out of the air is by you making your voice heard. And so I think that for coming back to Mayor Holt's point, we have to make the process of being an active citizen worthwhile, right? It actually has to mean something for people to get involved in the first place.
Hey, Adam, can I piggyback on just a couple things
sure.
that he's got my wheels turning, that I think a couple of interesting facts that would be interesting, especially to a Greek audience. When you hear turnout described in the United States, and it's usually the media who's going to say, okay, it was 60% turnout in this election or 40% turnout in this election. That is a very simple mathematical formula. They have put the number of people who voted atop the number of people who were registered to vote. So turnout is actually, the real turnout is a somewhat undefinable number. You have to do a much deeper level of research because you have to incorporate into that the people who were not even registered. And so if you were to hear that turnout was 50%, you know instinctively that real turnout is much lower than that, because the people who were not even registered were not even a part of that calculation. The other thing I want to say about registering to vote in America is, this isn't true across all 50 states, but many states have a requirement to register well in advance of the election. Some states allow you to register on election day, but in Oklahoma, for example, you have to register, I think, 25 days before the election. And just off the top of my head, as I sat here, I was thinking there's at least 7 elections in 2022 in Oklahoma that I could vote in, at least 7. And so that is not instinctive. You do not have all 7 of those elections on your calendar. People vote many more times than the presidential election that everybody hears about for many months. People vote in school board elections. People vote in city elections. People vote on a charter change. And you're not even really likely to hear about those elections until a week or two before their occurrence, but at which point the registration deadline has long since passed.
Yeah, I think one of the things that's really interesting, if you think about all the examples we've heard of, right, is how sort of like the links between active citizenship and health are often, are really not often obvious to people. They really are often sort of in the background. They operate through institutions or lack of opportunities not being presented to people or other kinds of enablers and things like that. And I think that it's like really important to sort of recognize that and to think about new ways of surfacing that and creating these opportunities. So I guess that kind of leads into my third question for the panel, which is, are there any sort of surprises or misconceptions that you've seen in your work about the ways in which active citizenship and health are linked? And do you want to start, or should we?
Are we going in order of height now? That's what I was told.
Well, we can also, if you want to, we could start with somebody different this time.
No, I'll go. All right, real quick.
Fine.
I mean, I think for obviously most Americans, they did not elect mayors and governors to be their chief medical officers, as I referenced earlier. That was not any part of their calculation when they cast their votes prior to 2020. So that was certainly surprising from a mayoral perspective, that suddenly you would be thrust into a role like that. I mean, again, at the municipal level in America, you're typically not running any medical facilities. Even your local health department is probably operationally separate. You are not administering, any government program like Medicaid or Medicare. You were really pretty separate from those issues, but suddenly you became the most important person in the world. A very deeply personal health relationship that usually occurs between a person and their doctor was now occurring between a person and their mayor or a person and their governor. And so that was certainly a surprising development. It is easy to think, well, that's sort of in the past now. It was a surprising development. It's sort of once in a century, we hope. But I think that Americans certainly, and really this would probably be pertain across the entire world, have to still look to their leaders moving forward and think about the lessons that we learned in that pandemic, and also what we learned about those individual leaders, about their adherence to science and their willingness to prioritize health. And so I hope that some things from that experience do not simply disappear. Also, though, I would say, and this could be surprising, there are opportunities even outside of a pandemic for leaders, to promulgate and prioritize healthy living. And so in Oklahoma City, when we were developing a major initiative that was going to voter approval in 2019, it was the opportunity to have about $1 billion of investment in our city, 16 different projects. We included things like the mental health crisis centers I was referencing. We included senior wellness centers. Obviously, seniors need active lifestyles, but they need the place to do that. They need a place to be social. And these senior wellness centers provide that. And also, a city has to provide the built environment for a healthy lifestyle. A lot of cities in America, I've walked, according to my Fitbit, I walked 10 miles yesterday, okay? I don't walk 10 miles in Oklahoma City in a year, because that's not how American cities are built, at least the farther west you go. And they are built around the automobile. People in my city, I'm just as guilty. I mean, we will circle a Walmart parking lot for 5 minutes just to get the closest spot rather than walk an extra 100 feet. So, it is incumbent upon leaders, and is therefore incumbent upon their residents to prioritize this and advocate for it, that you have a built environment. And so this initiative I was talking about in 2019, which we call MAPS 4, it has sidewalks, it has bike lanes, it has trails, it has the things that make it possible to even have that lifestyle. Because without that infrastructure, then it's really, you're just going to have to go buy a treadmill otherwise, So hopefully, people in America, through the experience of the pandemic, are recognizing which of their leaders are prioritizing health and which are not. And I hope that they will advocate for outcomes that do that.
Great, thanks.
Thank you. And I hope we're not going in height order, because otherwise I will never speak. Again, working on drug control, which is an issue which is a health issue, misconstrued as something else. Many misperceptions come to mind. I want to focus on two, however, which are the most relevant, I think, to our discussion today. The first one is one that I think we can all intimately understand from our experience as patients more than anything else, and is that misperception of us who are on the receiving end of a health service as inherently and exclusively passive subjects. So we don't see ourselves as people who have anything to do or anything to say, really, on health. We are seen as those who are receiving something if they're lucky, but not really as active subjects on that. And that's really dangerous and problematic for at least two reasons. The first reason is that when we are in need of a health service, we are in an inherent position of vulnerability, and so we enter in a relationship of power which is really unequal already. And so if we go into that relationship seeing ourselves as merely passive subjects, then that's where the relationship becomes even more unequal, and then when the dynamic is so unequal, then the space for abuse and violations opens up without any possibility for accountability. So first of all, we need to rebalance that a little bit. The second reason why it's problematic is because it's disempowering and disenfranchising, and it really takes us away from any opportunities that we do have to input on the health that we receive. And so it's a barrier to participation and thus a barrier to effective health services. The second misperception is more in line with what we were talking about before, and about this concept of citizenship and who is a citizen and who is not. And this idea that's really not acknowledged, often denied, but also very clear when we look at how health policies and health services are designed. And this idea that at the end of the day, there are different classes of citizens. There are those deserving, and there are those that are not deserving. And then when we bring stigma and discrimination and criminalization and marginalization into the picture, all of a sudden we identify more or less explicitly different categories and classes of citizens. And some of them really are not deserving of health, they're not deserving of quality healthcare, and they're definitely not deserving of participation. And I'm talking about communities such as people who use drugs, people living with HIV, sex workers, people with disabilities a lot of time, migrants, but there are many different groups, and they also change based on the societies we live in. And this is, again, another very problematic misperception, first of all because it drives those people away from accessing essential health services, if those services are created for them at all, because they are invisibilized a lot of times, and so they do not have services to start with. Pushing people at the margins and away from health is leading to negative impacts, not only on their individual health, but also on the health of their communities, and so on our health collectively. The second reason why that is problematic is because it pushes people away from participating, and so it deprives the community and us as a society of the expertise that these people can actually bring to health policies and to make our health services more effective. And I'll stop here. Thanks.
Great, thank you.
Yeah, so to answer the question about what's surprised between about the link, I've been really surprised at the research about purpose in life and health. And so purpose in life is the abiding intention to achieve positive personally meaningful goals and to make a positive mark on the world. And it's just common sense that we like to have purpose, but it turns out it's really important for health, that people who have higher purpose in life have fewer strokes, they live longer, they are less likely to get dementia. If you look at just about any health outcome, purpose in life helps. And of course, being part of a community and civically engaged can be part of purpose in life for many. And there, we can argue about the evolutionary psychologists, but it seems to be that we evolved for purpose in life to be so satisfying, partly because it helps us do big things together. And to be in this beautiful place, in this amazing city, you can it feels powerful just to be here, to feel all of the people who have worked together over the centuries. And I don't know how familiar you are with Maslow's hierarchy of needs, but it's the idea that you need to be able to breathe and eat before you can think of higher order things. And of course, your patient with asthma, she needed to be able to breathe. But I think Maslow got it wrong in terms that he has at the top of the triangle self-actualization and purpose, as though you need to take care of everything else first and then you can think about your purpose. But to me, anyone at any stage, at any moment, can also be thinking about what matters to them. She was taking care of her child too. She wasn't just thinking about her asthma. And that it's really broken to think, okay, self-actualization is just for the people who've got everything else going for them. We really need everyone to be involved. And just before I stop, I want to say that purpose in life, if you ask people about if they feel purpose and if they are able to act on it, it actually decreases with age in current societies, current Western societies. But that doesn't have to be. That's because in many societies, older adults have less and less of a role. It's not traditionally people were the elders and they lived with children and grandchildren and great-grandchildren, and they had incredible purpose. But at least in the United States and some other societies, older adults have less. They endorse that they feel purposeless, and that's something we can change.
I want to build off of that incredible point on purpose. So and tie it back to this question about misperception. So I think the number one misperception or common misconception when it comes to this idea of civic health is that physicians or nurses or social workers, they don't have time to do this. Right? This idea that we already have so much on our plate, we can't do this other thing. And I used to believe that as well. Until I saw what happened with our organization with VOTER. So as I mentioned to you all, we created these free kits, as I showed you all earlier, these lanyards and these badges that physicians and nurses would wear. And we were distributing something like maybe 100 to 150 of these a week in sort of March of, in January of 2020, February of 2020. And then, when the pandemic hit, do you think that we distributed more or less of these kits after the pandemic hit? What would you guys think? More? Less? Okay. It actually was more. Why? Because healthcare providers were seeing the brokenness of the system in full display. And they knew that the anatomy and the biochemistry and the pathophysiology we learned in medical school was not going to help solve this patient, address this problem, right? The fact that our democracy is under peril. And the only way to address that is actually helping people vote like their health depends on it, right? This idea of making it easier for people to participate in the system and that we as healthcare providers can do that, it offered this sort of outlet, this outlet valve. People were frustrated, they were angry, and previous to this, they didn't have a way, physicians didn't have a way, or nurses didn't have a way to address that frustration, that anger. This gave them one thing that they could do right then and there. Okay, you're upset about the way this works, so am I. Are you registered to vote? Because we can change it, right? And so we saw that incredible surge in these kits, and then after George Floyd was murdered, we saw another incredible surge. Why? My hypothesis is that people felt the same sense of frustration. We haven't made any improvements when it comes to our racial justice system in the country. And so healthcare providers were seeing another opportunity, an impetus to mobilize and to act. So those are the misconceptions that I think I'd draw.
Great. So we're going to segue into our final question of the panel. And as we were planning the panel, we wanted to make sure to be able to share a lot of the great work and the story that all these folks do, all the great innovative stories and that motivate them. But we also wanted to sort of inspire all of you. We also wanted to sort of ask them to talk about sort of what they see as sort of things that like all of you in the audience right now can sort of take away from the kind of work that they've done and the things that you can do in your own lives starting tomorrow, starting this afternoon, to build new links between active citizenship and health and improve the health of the communities in which you live and you care about. And so with that in mind, for this final question, I'm going to ask each of the panelists to sort of talk about kind of, what all of you as citizens can do. And in particular, I mean, really sort of like super concrete, actionable kinds of things, maybe that you can even do tomorrow that will improve civic health. And so again, we'll start with David.
Well, again, I'm going to look at obviously things through a perspective of electoral politics. And so, I would certainly encourage you, obviously, if you're participating in the American political process, the Greek political process, wherever it is, to be an advocate for the prioritization of health and science and all the things that I've described in the last hour. But I would also encourage you, kind of alluding back to the very first thing I said here, to advocate for electoral processes. And I don't have a clue necessarily how it all works in Greece, but in the United States, we have got to work towards electoral processes that allow for majority outcomes, that allow for coalitions of Republicans and Democrats who have shared interests to elect people or pass initiatives that reflect what the majority of an electorate believes. And so when it comes to the most challenging issues in American politics today, things like abortion and guns and the pandemic, it seems as if we're very polarized and hopelessly divided and that there is no majority opinion. But I actually believe that polling time and time again shows that not to be true, because that polling is usually done across the entire electorate. It's just that we don't actually run elections that way. We have these closed partisan primary processes that create these kind of warped outcomes that don't reflect anything but those subsets of the electorate that have registered for a certain political party. And so when people say to me, gosh, how are we going to solve this gun issue? How are we going to solve this abortion issue? How are we going to get good outcomes the next time that we're challenged like we were in the pandemic? And my answer usually has nothing to do with the substance of that issue. It is, we have to have electoral processes that like in Oklahoma City, where mayors are elected in a nonpartisan, basically top two format, you've got to have electoral processes where all of the candidates face all of the voters and all of the voters see all of the candidates. And then you will find, I believe, as polls often show on these tough issues, that there actually is a broad consensus across 60 or 70% of people. Taking this back to the topic at hand today, which is health, I think 60 or 70% of people, not just in America, but all around the world, have a prioritization on healthy outcomes and wanted to see an approach to the pandemic that respected the gravity of the situation. And so, we have to have electoral processes that allow that majority view to be promulgated in the outcomes that we ultimately have. So thank you again. This is my final time to speak, I suppose. So thank you again so much for having me, especially to the Agora Institute. And this has been a wonderful trip. I know I speak for everybody when I say it's been a wonderful opportunity to spend this time in Athens.
Well, you're allowed to speak one more time if it's to thank me. That's like totally fine, okay? It is interesting in political science. We often talk about sort of, electoral institutions are not necessarily like the sexiest topic, and I think, to your point, but yet incredibly important and affect outcomes in ways that people often really don't recognize.
Thanks. So Starting from the previous question, actually, the first thing we have to do is to rid ourselves of, again, as patients, as citizens, of that misperception that there's nothing that we actually have to contribute when it comes to our health and to the health policies of our communities and of our societies, and actually start seeing ourselves and our colleagues, citizens, as subjects that actually have a voice and can contribute to the process, to the development and the implementation of health policies and health strategies. And so really internalize this idea that we do have a right to participate in anything that concerns or affects our health at the local, at the national, and at the international level. Of course, with rights come responsibilities, and so the key one that I'd like to focus on for a second now is this commitment that we all need to have once we decide that we want to be active, to start from a place of evidence and science and data and best practice. And at a time now where we're all very quick to form opinion, to share our opinions on social media, whatever, like we have a voice, we need to really stop for a second, and that's something that we can all do tomorrow. We're in the library, and look at the sources and educate ourselves, starting from independent, reputable sources. We cannot afford to be ideological and political when it comes to our health. Again, working on drug control, we see how the solution a lot of times is counterintuitive, is complex, is never black and white, and we cannot afford to start with our preconceived options and ideas about what's right or wrong before starting to participate. The second thing that we can do maybe, and that goes back to that idea of misperceptions, is to start perceiving health, and we've touched upon that issue, as something that's never self-standing and separate. Nothing is self-standing, all issues are connected, but health is intimately and linked to all aspects of our lives. And the same is for policy and health policies. We can talk about health, and our health is affected by all the different policies that our governments and our authorities take for us. And so let's look at those intersections and let's work on them. Let's not just focus on what's called a health strategy or a health policy, but let's look at all other different policies, voting rights, but also things such as housing policies, tax policies, drug policies, agriculture, environment, city planning, waste management, and I could list all of them forever. Let's figure out who we are, how we can contribute, where our expertise is, and then let's bring health into the picture of other policies. And then in terms of what can be actually done once you figure out what you care about, just start looking around you and at what exists. I'm amazed every day by the wealth of community organizations, civil society organizations. Some of them are huge, some of them are very small. They can be neighborhood groups that are really active and effective in advocating for the health of individuals and the health of communities, and that need everyone's help. Look at the formal processes that exist. We're lucky to be talking here today about quite open societies in the US as well as in Europe. It's not the same as in other places, but there will be formal processes for feedback and for participation. And finally, once you have your foot in the door, or if you are in a particularly lucky and privileged position and you can actually influence the process, remember to keep the door open for others. There are communities and groups that have been marginalized and silenced, and that have been more or less purposefully kept out of the process. Remember to find them, to figure out who they are, to connect with them, and to bring them with you, and to ensure that they can also speak their voice and speak their truth and have their voice heard. Thank you.
Thank you. The first point that you mentioned about sort of the democratic mindset, I think anybody who sort of attends a panel on civic health or watches a panel on civic health is probably already has a pretty sort of deep and rich small d democratic mindset. But that's not true for everybody. I know I see this as a very different context, but with like students I teach, amazing students I teach at Johns Hopkins, who know everything there is to know about neuroscience, but have never thought about the idea that they could influence neuroscience policy. That's just, it hasn't crossed their mind. And it sort of, I think, speaks to this idea that like a small d democratic mindset is something that is a muscle that needs to be learned, as Hari mentioned before. Sarah?
Well, that's a great segue to something I was thinking about, which is at the School of Nursing at Johns Hopkins, we've just hired a health policy advisor, and part of her role is going to be getting policy actionable and mindsets into each course. So for example, in pharmacology, what's the next step you would do? You've learned all of this. Who gets vaccines and who doesn't? Or in in any of the topics, what's the next thing? It doesn't have to be federal policy, could be where you work, or in your family. And in terms of actionable, I know I was so impressed by Audrey Tang's talk. I know I'm going to be looking into polis and how people can do that at local levels. I talked briefly about building purpose in life in people, and there have been very sound studies looking at trying to build purpose in life in adolescents and young adults, and it turns out that reading poetry and novels can be really important in building people's purpose. So that's something. We're in a library. We could all grab a book and get others to grab a book. I think in the United States, we have an astounding proportion of people who are incarcerated in prisons, and they often had little educational opportunity before they got there. And there's a movement afoot, a small movement that's growing for people behind bars to get college degrees. And it turns out it's good for the colleges, it's good for the professors, and it's certainly good for the people who are incarcerated, and it really turns their lives around. And often the professors say their students in prison are more engaged than their students, their regular students who are 18 to 22. Just two other quick things. One is I think we need a really broad consideration of ethics, and thinking of ethics as this whole conversation in a way, and who's at the table, whose data is at the table, what part of data, and how do we pull ethical considerations into this whole discussion. And finally, at Hopkins, we talk about inclusive excellence. And I think we mean two things by that. One is that when we have more diverse voices, all kinds of voices, we are able to be excellent. The other is we strive to be excellent at inclusion. And I think if we could just get to be mediocre as societies at inclusion, we would be a lot better off.
I should just say that I actually did say exactly what you said at one point. I taught classes in the prison education program when I was at Cornell, and they were more engaged than my average 18 to 21-year-old. So I'm going to I said exactly the same thing.
And Pell Grants were just recently allowed for people in prison, and that's a giant step forward.
I'm going to be brief, y'all, because I know I'm the last thing separating you from the beautiful adventures that await you. I think you know what I'm going to say. The first is, do you know a physician, a nurse, a social worker, a medical student that cares about our democracy in the United States? I know for the Greek residents, maybe you have friends in the United States, you have folks that are in school. Tell them to go to this website, y'all, vot-er.org. It's free. It gets mailed to them within the next 3 to 4 weeks, and they can start helping their patients register to vote too. We need them. The second thing I'd say is Louis Brandeis, who is a Supreme Court judge in the United States, said that the most important office in the land, in America, is the role of the citizen. The most important office is the role of the citizen. I don't know what policies are sort of pressing here in Greece. I don't know what the challenges are in Greece. But I'll tell you what, I think the same holds true for you all here in Greece. The challenges that happen, the crises, the disasters, they all need your involvement as citizens, your active participation, your organizing, your mobilizing. I want to speak to the young folks for a second. The challenges that y'all face in this country, no one is coming to save you. It's up to you all to make this country for the better. It's up to you all to organize, to mobilize, and to do that work. And I want to just build off of what Sarah just said in terms of books. I promise you, Hari did not pay me to say this, but read her book, y'all. It's called Groundbreakers. All right? It looks at the Obama election, how the Obama presidency really sort of changed the dynamic of mobilizing and organizing. And her most recent book, Prisms of the People, is also an incredible treatise on how we can sort of begin to be more mobilizing and organizing focused. So those are the two next steps I would say for you all.
Well, on that note, please join me in giving a round of applause to a fantastic panel. And again, please take a look at all of these folks' websites, read Hari's books, and thank you so much. It's been a pleasure.
So before we let you all go, I just want to take a few minutes to thank so many people that played such a big role in making this happen. First, I really just want to thank our panelists. I remember when I was first working with our team and looking at the list of people, I thought, okay, so we're going to have a doctor, a dean, a mayor, and a human rights advocate. How is that conversation going to go? But it was terrific. And so really appreciate all of you taking the time to come here and be a part of our event. Also thank Minister Tang. I especially want to thank our audience members who joined us today in person and everyone who is joining us online. Really delighted to have you all be a part of this event today. And of course, we want to thank the Stavros Niarchos Foundation for making this entire event possible and also hosting us here in Athens. And finally, I want to thank all the people who've done so much work behind the scenes, Stephen Ruckman, Catherine Pierre, and the entire team at the Stavros Niarchos Foundation that really made this possible. So thank you, and I hope you all enjoy the rest of your day.